Well, I am really, really glad to be interviewing with you today, Dave. You and I met, I'm going to say it was probably 4 years ago. I remember
Hmm.
the very first time we met, we were standing in line to shake the hand of a dignitary. We were in a fantastic conversation with somebody from Mayo Clinic about bringing artistry forward on behalf of our endeavors with patient safety and just how important it is for leaders specifically to care for themselves. And you've been very consistent since that very first day that I met you in not just caring for others, but also in caring for yourselves. Even in this COVID-19 crisis, I think one of the first things I heard from you is how important it was to stay active, physically active. And I know that you've got this big walk for patient safety coming up. It's now moved from the Chicago or Wisconsin to Chicago area to the desert so that you can continue to isolate at home and take care of the quarantining that we all need and that makes such a difference for the health of and well-being of everyone in the nation. And I would just love to hear first from you about what inspired you to walk for patient safety. And what will it be, a month from now? Give us the date and a little bit of details and your inspiration, if you would, please.
Sure. And thanks, Vonda. It's been great since we first met, and the connections and the passion we both share around patient and caregiver safety. So I guess the original concept of walking, I had ran for many years. My knees at 67 years of age basically told me a while ago that running was no longer going to be in my armament of exercise. But I always loved to at least get out and walk. And for some reason, walking didn't bother my knees or hips, where running was starting to affect them. So I decided I would just start walking and just continue that as being my exercise. I love the concept. I used to joke that when I ran, I was like the loneliness of the long distance runner. Running for me was like meditation, it was reflection. It was my time to just get away and really think about things and be in a zone, so to speak. I'd put my headphone on with a little music. And I really wasn't the type of person that liked to run in groups and sit and talk and chat. People like doing that. That's great. And I found the same way with walking. It really has replaced that reflection part of my life. And so I started walking a number of years ago, and you know, I just always try to get in around 60 minutes of walk a day, which for me was about 3.5 miles at the pace I was walking. And then everything started popping up in late January. And as you've heard me say, I think a lot of the infection preventionists and a lot of the scientists realized that we were in the midst of something that was much different than we might have ever seen in our lifetimes. And I was really concerned. And as I saw things start getting worse at the end of January, 1st of February, I felt almost hopeless. Here I am now, a retired anesthesiologist. I work in administration, and I saw what was going to happen to the people at the front line, and I felt guilty. I couldn't be there. I didn't know how to help them. And I thought maybe I could walk. And at this same night that I was thinking about this, I happened to turn on Forrest Gump and the movie. And I got to the part where he just, out of frustration of not knowing how to handle his emotions, just started running. And he just ran and ran. You know, from the movie, I think he ran for 2.5 years straight or something, back and forth across the country. Clearly, I'm not at the age to do that. But he just got me saying, you know what? I'm going to start walking, and I'm going to start pushing myself, and I'm going to continue. This will be my release, but also if I could walk for those at the front line, if I could walk in memory of those that have lost their life due to preventable harm, I at least felt maybe I was helping the cause that we all saw and now are in the midst of the worst pandemic we have ever seen in this country in our lifetimes. And so that was the basis behind the walk. And lo and behold, every day I started walking in memory of a patient or a caregiver that's died of coronavirus. I also walk in honor many times of different groups of people who have gone above. They're heroes, whether it's the nurses or whether it's the physicians, whether it's a certain inner city critical access hospital that I know is under tremendous stress, even more so than maybe of the larger health systems at this time because of their financial constraints. So it just became part of my morning, and I just continue to do it. I've now walked 77 straight days without missing a day. I'm over 400 miles in total, miles walked. And the goal originally was to do that walk. I'm a big baseball fan, and even more so, I'm a big Chicago Cubs fan. And so I was going to start my walk in Milwaukee. I was going to attend the Cubs Milwaukee Brewers baseball game on May 22nd, and then start walking from Milwaukee to Chicago. It would have taken me 6.5 days, 100 miles, and finished at Wrigley Field, where I would have just walked literally right into Wrigley Field after finishing my walk on the 7th day, and sat in my season tickets that I still have with my son and some friends in Chicago, and took in the Cubs Cincinnati Reds game.
Hmm.
Unfortunately, baseball wasn't going to happen, and I've been sort of hibernating, so to speak, in Arizona, working with my team back east at MedStar on calls from here, as well as our people at the Patient Safety Movement in California from here. So I've had to rechange my walk now. And so what I'll be doing starting May 22nd, which is a Friday, I will start at Sloan Park, which is the spring training facility of the Chicago Cubs. And even though it's empty now, I will walk, and I will hit all 9 other spring training sites within Arizona, finishing 9 to 10 days later at Sloan Park again, where the Cubs do their spring training. So I do a loop from the Cubs site back to the Cubs site, and that loop will cover about 125 miles total over the 9 or 10 days, depending on if I do an 18.5-mile walk in one day or I split it in 2. And right now, my wife urged me to, in 102-degree heat, to split it into 2 days versus trying to do it all in one. So it'll probably be 10 days total.
I admire your creativity in, so everything has changed over the last couple of months as we have come to terms with the severity of COVID-19. And but I also just really admire your tenacity for, not giving it up just because you can't do it in Chicago with, landing at your favorite Cubs stadium, but going to the small parks. My son is a huge baseball fan and has been, I think I got in trouble for this as a parent, but we took him to it was a Milwaukee game when he was like 2 months old or something. And we had these little earplugs that we tried to put in his ears. And we visited many farm teams with him. So I can't wait to send this interview to him and just have him know about what you're doing. And I know he'll get really excited about that also. Dave, I have been noticing your acknowledging of the lives that have been influenced and experienced harm. Family members, patients, the caregivers who have experienced this throughout their career. And, 77 days in a row, and you've got, some 30 left, or 28, I guess it would be 28 plus the actual 7 or 8 that you're going to be on your actual official walk. So that's a lot of people to think about who have experienced harm. And I'm imagining also that over your career, you've probably known countless people who have experienced harm in medical care for one reason or another, both in the delivery of that care as well as in the receiving of that care, or just the supporting of it around. How do you keep your spirits up, knowing the severity of that issue and doing and dedicating your professional career to trying to resolve that very daunting issue? What do you do to keep your spirits up? And what words of wisdom would you give for people who might feel overwhelmed by that daunting issue?
Well, it is and can be overwhelming at times. Look, you've been very active with the Patient Safety Movement Foundation and so many causes and trying to make care safer ever since Yogi Raj passed away. So we've all through our careers, I've been doing this for over 20 years in leadership or clinical type safety roles. And yes, through the years, I've met too many patients who've been severely harmed, as Jack Gentry says, had life-changing catastrophic events that mimic plane crashes in their life, to others that have lost loved ones, from children all the way up to spouses and grandparents, due to preventable medical harm. And on the other side is we have caregivers, which I am. I was clinically active for many, many years. And I always said, no one goes to work to harm anybody. And we're devastated when something bad happens because of bad processes, bad systems. We haven't used human factors approaches in healthcare. We haven't given the nurses at the front line the resources they need properly to take care of the number of acute critical patients that sometimes could change within an hour on their shifts. We haven't just supported the technology and the clinical outcomes learnings that we could have had. So yes, it has been overwhelming. And as I've said, even when I'm done on May 30th, I'm not stopping my walks. I will continue to walk. I will continue to keep walking until we start doing more things to get it right. You know, we've been involved in this for 20 years. We've come a fair way, but there's still so much more to do. I always used to joke, especially to the students and residents that I teach, that psychiatrists and patient safety leaders are probably the two highest groups that are on antidepressants in clinical care, because we see all that. We see the pain and the suffering when one of these serious safety events or somebody dies within our system that they shouldn't have. And there's a lot of great things going on in healthcare, but when you're in patient safety, when you're in risk management, you just spend your time focused on the issues that drastically need to be improved quickly before future harm occurs.
Yeah, I can really understand what you're describing there. It's interesting because before Yogi Raj died, neither of us had, neither him or me had much engagement with healthcare. You know, we'd go see our doctor as we needed to, and we were certainly familiar with healthcare systems, but we had no idea whatsoever that there was a safety issue. And I think that there's still, to this day, now 8 years later, I haven't seen a lot of change in that. When I speak with people who do go into hospital or healthcare clinic settings, long-term facilities, rehabilitation facilities, they know, they see it every day, they understand. But the everyday householder, like myself and like Yogi Raj was that day, are still pretty clueless. And I'm really, really interested in helping raise the awareness at that household level, because I do think that it's the partnership when I go in to receive care with my clinician of choice and they've chosen me as a patient, we have an agreement together. And it isn't just, their responsibility, it's also mine. And it isn't just my responsibility, it's also theirs. And I'm curious what you think what's the most important thing that you think a householder would need to know to do their part on behalf of making sure that their healthcare centers in their community prioritize safety? What would you recommend to somebody who doesn't go into it every day like you do?
It's a great question because so many of the experiences we have with healthcare are very good experiences. We go in, we get our blood pressure checked, we, if needed, get put on a blood pressure medication that works, we feel better, you know, those types of things. We need a procedure done, we go in, we have the procedure, and it goes well. That's the vast majority of events. Then you get the second type of events where even though everything seemed to go well, there may have been some near misses. There may have been some unsafe conditions that, as we like to say, but for the grace of God, the patient
Hmm.
wasn't harmed. The perception is, whoa, I didn't, they didn't know that. They almost got the wrong medication dose that was dispensed. But somebody caught it before it got to the patient. Granted, a near miss, a learning event, and that's what we do much better today, I believe, in healthcare than ever, is that we're stopping the line, we're looking at those things, and we're trying to find out what went wrong and how we could correct it, even though the patient didn't know that something could have happened that might have harmed them. And then there's the last group, which are the parts where people do get harmed and they know about it, or many times, as we know, they're not told the truth. They're told that what happened to them, the harm that happened to them, was just a normal side effect or a risk of that procedure, when many of us know it really wasn't. So I think the first thing they need to do is find a health system, find a physician, find nurse practitioners that are willing to answer questions, ask questions, be inquisitive, want to know if you're going to get a medication, why that medication for my blood pressure versus another one? Why did you pick this particular class of blood pressure medications? Is it something about my health that makes me a better candidate for that? Or is that just a medication that you prescribe to everybody?
Hmm.
Why do I have to take a medication that's 4 times a day? Is there one that's maybe 1 time a day that allows me to have less chance of missing a dose if I have to take it 4 times a day, every day, or things like that? A lot of patients, I understand, don't know that. So bring the family together, have those around them, friends, family, help with that type of questions and answers to that physician. And I think if a physician ever pushes back as if the questions are threatening or intimidating or they don't have time to answer those questions, it's not a good situation then. You're not
Hmm.
getting the communication you need. And I think more and more you see physicians who are willing to sit down, and nurses, and explain things. But one, ask questions. Don't just go in like I think a lot of people did 20, 30 years ago and just presume the doctor was always right and everything that was done was correct. They are right. They are right many, many times. But unless you really have that conversation, the physician might not understand your needs as well. We talk about the term, and I know it's sort of overused, that patient centered care, but it needs to be a true partnership with the patient in the middle so their goals and needs are met by that particular care team.
Thank you. So ask questions, bring your family, get support from your team. And then if you do get pushback, take that as an indicator that that person may not necessarily be prioritizing safety above whatever it is else that they might be. In other words, use healthcare systems that are open to your questions and understand how important it is that you and your family members are engaged. I think that's really, really good advice. And I know that, with our family, we've learned a lot after the experience that we had. I feel like I'm a pretty confident person, but I'll tell you, I walked into that hospital with my husband in, a very critical condition, and I exerted myself to an extent, but I also did the thing that you're advising us to question, which is I just assumed that they were the experts and that they knew everything. And I did not necessarily push back, even when my gut was saying something's off here. And that is not something I do today, but it is definitely something I did in June of 2012. The other thing that I want to just, sort of raise that you said at the beginning, which I think is really an important point, is that we have a tendency to um, let let the system do the system thing. And I heard you say that often even the caregivers are operating in systems that are not necessarily set up for safety. And I know that's what you've dedicated your executive administration to, and the people that I've known who have worked with you so admire your prioritization of that. There are organizations like Leapfrog who really take a look at those systems that are in place with the Patient Safety Movement Foundation. There's this, 4,000 something hospitals alone, not even to mention clinics and other kinds of healthcare organizations who have made commitments, who have said, we will not stop until we get to zero. And I would love for you to just speak a little bit to that number zero. Oh, hi, Kathy. I see Kathy back there. I would love for you to just speak to that number of zero. What's in the number zero? Tell me, from your perspective and also from a systems perspective, why shouldn't we stop before we get to zero?
Hold on. I
Sure.
want to read here with the background noise and everything. That's okay. That's what I was trying to tell you. Sorry.
Tell her I said hi while she's there, please.
Yeah, Vonda's on here. She was interviewing me for a podcast. Sorry, you'll have to edit that. I didn't let her know that we were recording.
We didn't even hear the background, so it's all good.
Good. Okay. The number zero is so important. When Joe Kiani started the vision of getting to zero preventable harm, there were a lot of, I'll say, scientists and human factors engineers and all these smart people that said, oh, you could never get to zero preventable harm, and resilient systems and high risk systems, they achieve and they strive to get better each time, but to set a goal of zero preventable harm was really unrealistic. And I just struggle with that. What are you going to say? Our goal is 100 preventable deaths a year. Our goal is 5 preventable deaths a year. There were so many things that people said we could not reach zero. I'll give you ventilator-associated pneumonias. Many people said, oh, we could never achieve zero ventilator-associated pneumonias. And through bundles and evidence-based work, we basically have. The same thing with central line infection. I had good friends tell me, 5-6 years ago that we could never get below, say, 4 central line infections per 1,000 catheter days. They said we work in an environment that have so many risks. We deal with heart surgery patients, we deal with neurosurgery patients, we deal with trauma patients and cancer patients. How can you get to zero preventable harm? And they thought 4 infections was a great number until the Keystone Project. And people showed by following good evidence and bundles and best practice and stopping the line, if even a possibility of a breach and sterility happened. We've had so many hospitals that have had zero preventable or zero CLABSI events. So when people tell me, oh, zero is unachievable, I say, it may seem so today, but I don't know a year from now what we'll be looking and how we'll be looking at C. diff infections. Maybe we've got different antibiotics or different lines of treatment. We have some amazing research and development that's going on. And so to say we can't get to zero, I just say, yes, we can. We just haven't figured that out yet. But there are a lot of smart people who I think will help move us to those numbers and to move us down to zero. You got to, we always say, why zero? Because 1 is just 1 too many.
Yeah, thank you. I certainly wouldn't want my beloved to be that one who gets left out. And I completely agree with you and I really appreciate that coming from a person who knows the systems and knows what's possible, and also who has seen progress over time. um, I know even in 8 years, I've seen tremendous progress happen because people are prioritizing it and dedicated to that zero number, making sure that no one gets harmed, that we learn from those mistakes. Another time, I would love to hear more from you about transparency, because I know you've dedicated a lot of time and attention with the Candor program and other programs that really increase transparency. But we're getting close to the end here, and I want to ask two more questions. One is,
Sure.
when you think about COVID-19 and the pandemic that we are experiencing right now, one of the concerns that has been raised with me is that patient safety may not necessarily be a topic of great importance, given that we have so many caregivers who are giving of their lives on behalf of others right now, and the economic turns that have taken, and just the devastation that this virus has had around the world. But at the same time, you and I know that all those safety measures and the priorities of those safety measures that have been implemented and have been evidence-based and proven and are ingrained in our healthcare systems right now are serving those same caregivers and those same patients today. It scales. So if we have a surge like we're having now, those safety mechanisms surge at the same time. Unfortunately, the opposite is also true, right? Where a hospital may not have put provisions in place for safety, it scales negatively. And we anticipate that we'll see more negative safety events because of the surge itself. I'd love for you to speak to that a little bit from your perspective. What would you like the caregivers and patients and family members to know right now about the relevance of patient safety and COVID-19?
I think this pandemic has brought out what many of us were concerned about long before, years before. We've gone through this horrendous period in our history. The healthcare system, as great of a job as it was doing, people have been living longer, we're curing cancers we thought never cured. The procedures have become so minimally invasive that you go in and have a knee replaced and be out in 4 hours today. That used to be 7 to 10 days when 20 years ago.
Yeah.
So you look at the great things, and yet we kept trying to warn people that the system was on the verge of a collapse if it got stressed, and it was on a path that was not safe for not only patients, as we've shown with numbers and outcomes, but for our care teams, for those at the front lines. I love the work that was done a number of years ago through the Lucian Leap Institute by Lucian Leap and led by Paul O'Neill, who just recently passed away. He was really a hero to many of us in the work that he had did and when he was at Alcoa that he brought into the healthcare community. It was his philosophy that you have to do everything you can for the safety of your worker. It wasn't, if you just put safety first, profits, growth, everything else would follow.
Mm.
That's what he did. He just invested and put in resources and protocols and stop the line type procedures that made Alcoa one of the safest, if not the safest, aluminum business in the world. And what happened? Profits went up, morale went up. People wanted to come to work. They worked harder, and it was a beautiful thing. So the document that they produced together through the Lucian Leap Institute a number of years ago was called "We Need to Bring Joy and Meaning Back into the Workplace." And there were a number of tenets in there and recommendations. What it was trying to address, we've known the suicide rate for doctors is higher than the general population. We know the suicide rate for nurses is higher than the general population. Depression rates, divorce rates, burnout rates are at all-time highs. We've known this for 4, 5, 6 years, and
Mm.
we haven't addressed it. And if you don't address the safety of the health system as a whole, patients and families are going to suffer, and the people at the front line are going to suffer. It's not just the doctors and the nurses. Think about the environmental protection specialists who spend their day cleaning rooms of patients who've passed away from COVID-19. If you don't think that's not only physically stressful and potentially dangerous to their own well-being, think about their mental well-being. Think about these caregivers who are working 18 hours. This is a war, and these people are going to suffer for years and years to come, even when the pandemic has finally, hopefully, passed us years later. And we have to correct the safety of the health system and not just to pick pockets. So I think, and I hopefully believe, that not only will we come out of this with a newer understanding that the system needs to be supported, it needs to be solidified, and the safety and the quality of the work needs to be improved. And if we don't put resources and funds into this, it's just going to break when the next stress comes again, and potentially worse.
Yeah, thank you. I think that dovetails perfectly into my last question, and that really goes back to the householder. As a clinician, as a long-term administrator within healthcare who has dedicated your life to patient safety, what with this COVID-19 having revealed those cracks in the system that we knew were there. You knew they were there because you are in there and trying to fix them. I know they're there, and our family members know it's there because we lost a loved one because of those cracks in the system. For those who are sitting in their household and they're wondering why would they want to get up and be in motion, or move in some way, whether they're walking with you or walking from home or virtually in a march for patient safety come September 17th, which many people know, I'm zigzagging to DC for this. Even if we're not able to physically march together at that time, Capitol Hill's not going anywhere, and I intend to, and I think there are a number of us who still intend to meet with our legislators that week, September 17th. What would you tell the everyday householder about why it's so important for them to get involved, for them to show up for patient safety?
I think the main reason is, I don't care if you're a doctor, a nurse, a pharmacist, if you're a congressional leader, you're a comedian, a movie star, whatever, we're all patients. And whether we are today, we will use the health system. It's almost inevitable. And you can't wait until you need it to find out it's deficient, as we've done now. That when there was a crisis, this was a huge, not only national, but international crisis. But many of us have personal crises that need to be treated in more of a one-on-one type thing. We need to correct the systems now. And if the corona pandemic doesn't alert us and doesn't wake us up to what we need to do after this virus has finally gone away, if we don't rise in a year that's very political, and we've got an election coming up, if congressional leaders really don't see the weaknesses and want to ignore it and call these things hoaxes again, then, Avanda, I don't know what will ever wake people up to the reality of what we need to do. If you're willing to accept a system that does a lot of great work, but is still very broken in so many key areas, and not willing to invest to fix those key areas to make it so much better for everyone, like I say, I'm just going to keep walking till I drop. I don't know
Thank
what
you.
more we could do to get people's attention after this. So hopefully we won't go back to the way we were 5 years from now and forget about it and get apathetic again and say, okay, things are good, nothing bad. We do that. I think I do it myself too many times. We need to get through this pandemic. We need to support those that are really hurting, and we need to find ways to build up our resources so we are better
Mm.
for the next event that'll happen.
Thank you. It's perfectly put. Really appreciate you taking the time to speak with me today, and I look forward to getting this posted and sending it out to our network so people can hear from your perspective. And
My
if there's
pleasure,
anything
and
else,
God bless you for what you're doing. Six
thank
months
you.
of driving across the country, sharing your message, interviewing people, creating awareness. You know, it every one of these little things, it takes a village, and we're all a growing village.
Yeah, we are. It's a growing village of people who hopefully at some point will be able to look to one another and say, we accomplished this. Medicine is different today because of our walks and our attention and our dedication. And I know it's, we're just two people among millions around the world who have made these kinds of extraordinary commitments in terms of time and attention and budget and resources. Dave, thank you so much. I'll look forward to getting this posted. I'll make sure you get a link over to it, and I'll make sure that your walk gets a link also. And for those who are listening, please go on and make a donation to Dave's walk, which begins on May 22nd and goes for somewhere between 7 and 8 days, depending on the heat in Arizona, it sounds like.
Yep. And but thank you, and stay safe during all
Thank you.
these travels that you're doing.
Absolutely, I will. You too. Take good care.
Bye.
Bye-bye.